Tokyo is a kind of overwhelmed and a sick patient. If we don't accept these patients, and the patient dies.
Okay, I see. Right. So until 2 weeks ago, this room here was just a normal nurses' station for the ICU unit, which is behind this wall. But as you can see now, it has been completely transformed. These big TV screens have been brought in, the computer monitors have been brought in. There are monitors for each of the patients that are inside the ICU unit here, telling their vital signs. And the idea is that they don't send so many people actually inside the high dependency unit that they've created here. They can stay here and they can communicate. They can monitor each of the patients from here, and they can communicate with the small number of staff who are going in to actually carry out the care. And the reason for this is basically they don't have enough equipment. They don't have enough PPE, and so they're trying to limit the number of staff who actually have to go inside the high dependency unit, which is behind this wall.
Many patients in the hospitals are 40s and 50s. They may become a very sick COVID-19. Once COVID-19 is a very sick situation, they have to stay in hospital with intubations for 2-3 weeks. So that is a real situation.
So you can see here on the wall are listed all the different departments: internal medicine, heart center, psychiatry, and so on. But what is noticeable, and this is very common in Japanese general hospitals, is there is no infectious diseases department. And that is because there are specialist infectious diseases hospitals in Japan. So what has happened here in the Mariana is they have taken over the critical care area, and that has been converted into a specialist negative pressure COVID-19 ward. And this is COVID patients.
And the yellow is to change the dressing.
Where I'm standing here, I'm in the green zone. This is the safe zone. The yellow zone, this is an airlock in here. And right through there, you can see the second door. That is the entrance to the high dependency unit. That's the red zone. Now, this has all been built, literally, in the last few weeks.
The stress of the crew in the ICU is very huge because they are taking care of the patient, and with even full PPE, still there is a risk of infections. So it's very, very stressful.
Yeah, it must be.
We give a message to the people that the healthcare workers working like this. So we need help from the population to stay away contacting many people.